Have with us on the BT Couch once again. From Wise Women Montreal.com, one of our favorites, Lisa Brookman, is here. Good morning. Happy New Year.
Same to you.
Thank you. All right, we're going to talk about something very serious now. With the winter, people tend to use this expression, the winter blues. Oh, I'm feeling depressed. We're going to be dispelling some myths about depression. First of all, Lisa, depression is, for the most part, it's not a fleeting feeling. This is a very real illness that people struggle with.
It's a very, very real illness. It's very close to my heart. I have someone close to me who struggles. I also work my private practice with people struggling from depression.
This is not sadness.
This is not sadness, and that's one of the major myths. People think, oh, the person is sad, kind of move forward, get over it. This is an illness. It's a mental illness. It should be treated as if you have a heart condition or diabetes.
So what are some of the things that you should be looking out for? Say someone's watching us right now at home and they're feeling sad, they're feeling strange, they're feeling different. What are some of the warning signs that this is not something that is going to be going away and that you need help for?
So firstly, if it comes out of the blue, a situational depression would come if you recently broke up with a boyfriend, or you lost your job and you're down and you're sad, or someone's died, and you go a couple weeks, you're feeling really blue, and then you kind of snap out of it and you kind of go back into your life. If you're really stuck and either nothing's happened or something has happened and 2, 3, 4 weeks have gone by, you're still feeling, physically lethargic.
There's a physical aspect to this too.
Yes, a huge physical. I mean, people have told me that their body from head to toe physically hurt, even the thought of taking a step forward. So if you have that, if you have kind of an emotional, overwhelming sadness that you just feel like you're blocked, you can't move forward, the thought of being social, going to work, even going to eat breakfast is limiting to you, that's probably a time where you should start to kind of speak to your GP and see if there's something medical going on, or in fact, if you are struggling with depression.
And one of the things that a lot of people struggle with, people in their lives who have depression, they just want to say to them, snap out of it, get out of this place that you're in. What do we need to keep in mind when dealing with people in our close circles who have depression?
Well, definitely it is overwhelming to have a loved one or a friend, a family member who struggles with depression. But I think one of the most important things is empathy and patience. Trying to understand, and it is so hard to understand, it's so complex, but to try to understand that your loved one is really, really struggling. They're like paralyzed. To be patient with them, it's wonderful to be there for them and to support them, but there's this kind of this urgency with wanting them.
I feel like people want to push people out of it.
Get with it, snap out of it, get moving.
That's not the way.
That's actually probably one of the worst things you can do.
Okay.
So the patience, be there for them, listen to them. Supportive listening is so wonderful. Affirm, understand that they are struggling, that it is difficult what they're going through, and what can you do to support them. I think one of the biggest things that people who struggle with depression feel is a sense of isolation and loneliness. And they tend to do that. They pull away from society. So
and should you give them their own time, or should you?
I mean,
surround,
a certain amount of time, okay. But I really feel that as a loved one, you should support them, surround them, encourage them to get supports. Ask them, do you want me to accompany you to a doctor's appointment or to a therapy session? I'll come pick you up. I'll take you out for lunch. I'll bring you home. Because the truth is, the more you put into your daily life that makes you feel pleasure, the higher your self-satisfaction is. So if you are sitting home in bed and you're crying and you're blue and you're staying under the covers all day, your life satisfaction would probably be a 2 on 10.
Right.
But if your friend comes and picks you up and takes you to your favorite lunch restaurant, and then you go for a manicure and you come home, chances are you might not feel amazing, but you might be a 5 or 6 on 10, which is an improvement.
Thank you so much, Lisa Brook.